So today I'm going to show you a couple of applications for common issues such as headache and a common cold. As we know, it can have different toy knot techniques. You're either going to want to be more tonifying or more purgative depending on what kind of diagnosis you have. With colds, usually we're looking at a wind cold or wind heat kind of thing. And so we're going to start with some seated applications. And so I'm going to take this pillowcase and make it like a little bonnet. You want to make sure not to cover the person's face. And then we're going to stroke from the front to the back. It doesn't look like we're doing very much here, but it does feel very good. So we're going to go from the front to the back. And we're not going to use our nails, we're just going to stroke the head. And then you're going to go from one side to the other. So front to back, and one side to the other. I like to use a pillowcase or a towel here because you'll have less problems with catching, in the hair or with any kind of earrings or other jewelry. You could use this for a common cold with symptoms such as headache, stiffness in the neck, or for just a headache of any kind. Okay? The next one we're going to do is we're going to keep her seated and we're going to move this to the back. And so for here, let's have you turn just a little bit. Just turn a little bit, your body a little bit there. Okay, not like your whole torso. Sorry. So here we would want to do some grasping on gallbladder 20 and 21. You can also do it with the nape of her neck here. So this would expel any kind of wind and also help any kind of tension headache. So it's grasping. Now depending on if we want to tonify or sedate, we could choose to do nipping or kneading, knocking or chopping on the upper shoe points. Okay, so assuming that she's more deficient, we could do a nice kneading here for a cold or headache. And you can keep the patient seated or have them prone at this point. And then if she had more of a, we want to do more yang techniques, we could do knocking on still the upper shoe points. We're not going to go to any kind of low tonifying kidney points. Or you could do chopping. The knocking here is really good if she has any kind of phlegm or congestion in her lungs. A lot of times patients will end up coughing a little bit afterwards, but that's good. We want to bring that phlegm up and out. These treatments would all last about 10 minutes with each technique. You could also do this technique prone. Okay? Alternately, we can go to some distal points, okay? And so if we were going to do some points on her arms, we could nip LI11, okay? And this would be good if she has any kind of heat in the body. You could do this for several minutes. You'd also go down and nip, it's harder for you to see, but nip Sanjiao 5, our wind point, and LI4. At this point, you could also do some basic kneading if she has any congestion around LI20, Yin Tong, Yu Yao, Tai Yang around the face. And that's some basic applications for common cold and headaches. One more that I want to show you, because it's a little bit different and interesting, is the pounding for a headache. So we're going to do a little bonnet again. It's not necessary, but it's fun. And here you would do a loose fist, thumb inside, and you're just going to let the weight of the hand fall on the head. This helps to disperse any kind of stagnation in the head and can move blood to help a headache feel a little bit better. This is very gentle. You want to make sure you're not creating any kind of compression on the cervical vertebra while you're doing this. So you just let the weight of your hand fall. And that's some good basic techniques.